With Nova News, I'm Miguel Badia with Patrick Lyons, and today we're speaking with Villanova graduate students about the impact of the coronavirus pandemic on Villanova's campus, as well as the Doctoral Student Council's recent advocacy for better access to affordable healthcare benefits for students.
So our first question, what does student life currently look like for a graduate student?
For me personally, my research hasn't stopped. I still have sort of a constrained amount of time to get everything done. I still come to campus, and like last semester I was coming to campus pretty much every day to, continue my research and, do everything. So nothing's really changed. I still teach in person. It's pretty similar to how it was before the pandemic.
I'm in the part of my program where we teach Philosophy 1000, and last semester was my first semester teaching, so it's all been very unusual. I don't know what teaching was like prior to COVID, or at least teaching my own class.
There was a lot of fellowship and scholarly community sort of built in lounges, built in between classes, built during breaks that we had, and that's pretty much sort of gone at this point.
And graduate student life, like under normal circumstances, is a little bit isolated as well, because we all live like off campus, and so it's even more isolated under COVID.
What are your thoughts on the university's response to the pandemic in general? And thus far, are you satisfied or dissatisfied, or somewhere in the middle with the protocols that they've implemented?
Since I am in the bio department, I do teach labs, I TA labs, and pretty much all labs have to be in person. And the departmental response has been pretty good with dealing with the coronavirus, but that is to say we still don't have health coverage through the school, which is, we're sort of on the front lines in lab as TAs, and we don't have any sort of support, which sort of puts us on edge.
And the university has reassured us that the classroom is like the safest place for students on campus, and that there's no evidence of transmission in the classroom. So, I mean, obviously that's reassuring to hear, but just being in a room with so many other people for extended periods of time makes you nervous, especially if you don't have adequate healthcare coverage. And so that's why a lot of my classmates who are teaching this semester but have pre-existing health conditions, they opted to teach online.
How did this kind of movement start within the Doctoral Student Council to advocate for better healthcare benefits from the university, and what progress has been made so far?
Faculty and students have been very vocal, or have been vocal about better healthcare benefits for doctoral students for over a decade. I started my program in 2016, and it was then that doctoral students in philosophy started administering a survey about students' like healthcare situation and health situation across class. So we didn't survey engineers. And it was from the results of that survey that we were able to secure a $1,000 healthcare subsidy for all doctoral students. So that was amazing. So that happened in 2017. And every year since then, we've been bringing up the issue of like increasing the healthcare support from the university.
So as master students, we actually don't receive any sort of support, any sort of help receiving healthcare. And there's been a few master students who've had to, do things such as, get married early, or, register their address in another state to obtain healthcare, because, there's a lot of master students who are older than 26 and aren't on their parents' healthcare. So it really became an issue because of that.
The Doctoral Student Council, which had performed another survey of doctoral students in the fall, which revealed staggering numbers of out of the 87 respondents, 11% were not insured at all, and around 40% felt that were underinsured, no matter the plan that they were on, whether it was through a marketplace or through a partner or some other form. So this is a pressing need that we are continually asking that be addressed right now. And we did send that report that reported the data, and it is publicly available if anyone is looking to access it, to the admins with a letter asking for better, more affordable, and more accessible options through the university.
I mean, the advocacy is born out of a real need. There are so many reports from like the various surveys we've done over the years of students foregoing treatment for like health conditions or accidents. For example, like a miscarriage, somebody went without like seeing the doctor for days and days until finally they had to go to the ER room to avoid like ectopic pregnancy, right, which is life-threatening. Someone had severe COVID last semester, walked themselves to the ER room and found out the treatment would be $40,000 and then walked back because they couldn't afford it. And when students absolutely have no choice but to seek treatment, they've accumulated debt up to like $10,000. This is not a situation we want to be in, but because of the high deductibles that come with insurance on the healthcare marketplace and like the expensive price tag on the BU plan, it's a situation we're kind of forced into.
What has the university's response been? And do you feel like there's generally support? And then to build off that, you guys have all touched on it a bit, but what are kind of the next steps for this initiative going forward?
I think like a patient response would be the best way to put it, suggesting that they hear our concerns, that there is sometimes money available through a hardship fund, but they can't necessarily make space for immediate action right now, and that they're working on it and trying to figure out the best way to solve that.
Well, we had an event as part of Hunger and Homelessness Awareness Week, and that's actually where we met Damir. That happened on February 1st. And there were many members of the community there and people, alumni, emeritus professors, and people from like neighboring universities. So at least the community seems to support the students' request for better healthcare benefits. It just seems like a request that doesn't require that much explanation during COVID. We need immediate action because we are in recruitment season for the next academic year, right? We are, and new graduate students or prospective students are thinking about whether or not they want to come to Villanova. And so whether or not the university offers healthcare, I think is going to be very important for future students' decisions.
What other plans do you have for just kind of getting the word out in general and raising more awareness to the issue?
Yeah, the Doctoral Student Council will be offering both a series of workshops to hopefully secure not only doctoral students, but also graduate students, adjunct faculty, and really like those workshops and social events are both meant to bring people together who are experiencing similar things from the university to talk about it and to sort of see where the stem of this issue is, and then we continue just to have conversations with administrators to keep working through what we see as the solution, which is full and adequate access to comprehensive healthcare.
That's really our big ask right now. And it's, again, something we've been asking for many, many years. Offering healthcare to graduate students, that's not only going to help graduate students, that's going to help the university attract talent.
As grad students, there's anti-moonlighting clauses, which means that we can't work outside of the university. We can't get other jobs. We have to basically rely on the university for all of our support.
I think I'd finally conclude with an appeal to sort of the Catholic roots of Villanova and Catholic social teaching, which really is concerned with both the flourishing of life and the dignity of life, and also the dignity of work. The graduate students are performing a work for the university while they're doing their studies, like Jen teaching classes and Damir teaching in the lab, and that dignity and to dignify people's work requires providing them with the resources that they need to survive. And in 2021, United States of America, that includes affordable, comprehensive, and accessible healthcare for any needs that students might fall into. And I think really, if we're committed to being a community first institution, that needs to be followed through.
Well, thank you so much for your time today, and we appreciate all your insights with regards to this very important issue. With Nova News, I'm Miguel Badia with Patrick Lyons signing off.